Hello. So I'm going to come in and introduce myself to my patient. So my name is Shelley. I'm a nurse practitioner. I'm going to be performing a head to toe assessment on you today. So I am going to wash my hands, and then I'm just going to do a general survey of my patient to test for a level of, if my patient's having any kind of level of distress. So my patient is sitting upright. I don't see any persistent breathing. She's not having any nasal flaring, and she looks like her circulation looks to be okay. So then the first thing I'm going to do is perform assess my patient's head. So her head looks normal cephalic. So I'm going to palpate her head for any kind of tenderness, masses that might be there, and her hair texture, which is moist. So after her head assessment, then I am going to take a look at my patient's eyes. Her eyes look symmetrical, and she does have a lazy eye on her left eye. I'm looking for any kind of drainage, any kind of redness, and I don't see any of that in her sclera. So I'm gonna look at her conjugal. It looks red. That's red. Look up. Okay. Then look down. I do not see any kind of lesion in her conjunctiva. So now from here, I am going to perform a eye exam using a visual acuity, using the Snellen visual chart, and it is going to assess for cranial nerve 2. Cranial nerve 2 will consist of the visual, doing the visual acuity, and also doing the visual fields. So I'm going to have my patient to stand up. Now, I will do this on her right side, left side, and then with both eyes. Do you wear glasses? Okay, you want to grab your glasses? You can put them on. And so I am going to grab the Snellen chart, and I'm going to have you to hold this arm's length with your right arm. Okay. And then I'm going to have you cover up your left eye. Okay, now tell me what you see. What line do you read? Can you read that line? Say the letters out loud.
E, P, T, C, O.
Okay, and then we're going to do the same thing with the other arm. That arm's length. Can you read that line?
C, F, D, H, J.
So my patient's vision is 20/25. I will also do that with both of her eyes. Okay, so now I am going to perform the visual fields. I'm going to check my patient's visual fields. So you want to turn and face me? Okay, come up just a little bit. Okay, so I'm going to have you to cover up your left eye. I'm going to cover up my left eye. No, that's your right eye. Cover up your left eye. Okay, and I'm going to cover up my left eye. Look at me straight, and you let me know when you can see my fingers, okay?
Yes. Yes.
Okay, now switch over. Look straight.
Yes. Yes.
Okay. So, cranial nerve 2 is intact. So from here, we are going to do, I'm going to take a look at the inside of my patient's eye. So go ahead and have a seat for me. Okay, so I am going to kind of turn down the lights a little bit, only because it'll make it a little bit easier to see her red reflex and then to assess her pupils. So the first thing I'm going to do is just kind of test her pupils. Look straight ahead for me, and they should constrict when the light is reflected in them. I'm just gonna kind of come on this side. Look straight ahead. I'm gonna come back over here and do this one again. Look straight ahead for me. And her pupils do constrict. They are 3 and go down to 2. So after that, I am going to have my patient to follow my pen light with her eyes. Okay. And I'm gonna check her 6 gaze of field. Okay. So just keep your head straight, and then just follow this pen light with your eyes, okay? Ready? Look straight ahead. You looking straight ahead? Okay. Eyes, follow this. Here, follow this. Nuh-uh. Look at me. Okay. Follow this pen light with your eyes. There you go. Track them. Okay, now I'm just going to have you take a look at this, and I'm going to bring it towards your nose, and you just focus on this, okay? Follow it. Okay. So this is assessing for cranial nerves 3, 4, and 6. So now I am going to take a look at the inside of her eye, which I want to look at her red reflex to see if it is intact, and look at any kind of vasculature abnormality that I might see in her eye. I am going to keep the light turned down because it'll make it a little bit easier for me to see her red reflex. I'm going to kind of hold her eye open just a little bit. And I'm just going to come a little close to see if her red reflex is intact. And her red reflex is intact. So I'm going to come over here and do the same thing with this eye. Going to find it first. And I'm just going to kind of zoom in. All right. So red reflex is intact, and I did not see any kind of abnormal vascular changes that might be going on inside her eye. So from there, I am going to I'm going to take a look at her nose, examine her nose. Her nose looks symmetrical. I don't see any kind of abnormality of her nose. So I'm going to examine the inside of her nose to check for patency. So just hold your head up like that for me. I am going to go ahead and turn the light back on because it'll make it a little bit easier to see what I'm doing. Okay, so hold your head up. I'm going to take a look at the inside of her nose. Look at her turbinates. They look red. I'm going to come over here on this side. And her nasal passages appears to be patent. So from there, I am going to go ahead on and assess her lymph nodes. First of all, I'm going to assess her sinuses. I'm going to check for any kind of tenderness and any kind of pain, and if there's any kind of lumps or bumps that might be present. So I'm just going to kind of palpate her sinuses for any kind of tenderness here. So no tenderness. So now I am going to check her lymph nodes. So I'm going to do preauricular, post, her occipital. Hold your head down for me. I feel her occipital. Okay, doing that with like the tips of my fingers. Normal lymph nodes, you cannot really feel them because they should be less than 1. They're normally mobile and non-tender. So post, then I'm gonna come down, you can hold your head up. I'm gonna do her submental, submandibular, her submental, then I'm gonna come on down and assess her tonsillars, and then from there, I'm gonna do her anterior cervical. Then I'm gonna do her posterior cervical. Hold your head down for me just a little bit. The back of her neck. I'm gonna have you stand up so that they can see my position that I have. All right, and just kind of turn around there for me. And then, go ahead and turn that way. Okay, so it will be, and I'm gonna be here. So it'll be here that I will be checking her lymph nodes. Okay, so you can go ahead and have a seat again. Actually, just turn face me, and I'm going to go ahead and do her subclavicular. Hold your head up right. And I don't feel any kind of lymph nodes there. Okay, you can go ahead and have a seat. Okay, so we have assessed her eyes, we have assessed her nose, and we have assessed her lymph nodes. So from there, I am going to assess her mouth. I see that her mouth is symmetrical, symmetry. Her lips are moist, non-cracking. I don't see any cracks in her lips. So I'm gonna have you just kind of hold your head up and open your mouth. So I'm gonna look at the insides of her mouth, her boca, to check for any kind of lesions, to check for any kind of redness that might be there. Okay, hold your mouth. Then I'm gonna look at her soft palate, hard palate. Now, hold your tongue up for me. Then her soft. Okay, you can just, and then just close. Okay, yeah, just open your mouth up normally. Open your mouth. And then a little bit wider. I'm gonna take a look at her teeth. I don't see any kind of decay, and her teeth are intact. So from here in her, say ah. I'm looking at the back of her mouth to check out her uvula. Say ah, stick out your tongue. And her uvula is midline. So from here, I'm gonna have her stick out her tongue, and I am going to assess for cranial nerve 12. So can you say ah again? And can you wiggle your tongue from side to side? And that assess for cranial nerve 12. Okay. All right, you can go ahead and close your mouth. All right. And then from there, I am going to examine her ears. So first of all, I'm gonna kind of take a look at her. Turn your head this way so that they can kind of see what I'm doing. So I'm taking a look at the curvature of her ear, and I'm going to palpate her earlobes and kind of go up. I don't feel any kind of masses. I don't see any kind of drainage in her ear. And so now I'm going to look at the inside of her ear. Having a hard time with my, there we go. I'm like, why am I having a hard time with that? Okay, so I am going to take a look at her ear. Just hold your head up for me. Looking at her tympanic membrane, which is pearly gray. I'm looking at wax consistency. I'm looking to see if there's any kind of redness or any kind of drainage coming from her ear. And I do not see that in that right ear. So I'm gonna come over and take a look at the left ear. Turn your head that way for me just a little bit. Okay, good. Gonna pull it back. All right. Same thing, I'm looking at the wax. I'm looking for any kind of redness or drainage that I might see in her ear, in the bony structures of her ear. And so I don't see any abnormality of her ear. So from there, I am going to listen to her lungs. I'm going to have you stand up while I do this because it'll make it a little bit easier to listen to her lungs, anterior and posterior. So just look straight ahead. Okay. So I'm just going to listen to her lungs, and I'm listening to make sure I don't see hear any kind of wheezes, rhonchies, or crackles. And to make sure that the air is moving in all the bases of her lungs. Okay, deep breath, then out. Again, then out. Again, then out. Again, and then out. One more time, and then out. Again, out. Okay, kind of come down here, in and out. I'm gonna just go ahead and in and out. Then I'm gonna come over here and I'm gonna do the same over here. In, then out. Then I'm gonna come over here and go, and then out. And then I'm gonna have you just turn around. And then I'm going to listen to you, her back, posterior. Take a deep breath, then out. Again, then out. Okay? Out, in, and out. And then I would listen to her in all the lower bases to make sure that she is clear. Okay, so from here, I'm going to have you have a seat again, and I'm going to assess her heart. I'm going to listen to her heart for her rate and her rhythm. And you can just breathe normally, okay? Second intercostal space is her S1, her aortic, pulmonic. Third is her intercostal space, is her Erb's point. Fourth is her tricuspid. And then down 5, intercostal space, midclavicular is where you will hear the mitral valve, and that is her point of maximum input. Okay. And I don't hear any kind of abnormal, like her rate was regular, and her rhythm was not fast. It was not fast and not slow either. So from there, I am going to go ahead on and assess her abdomen. So I am going to have her to lay down. Okay, so I'm gonna have you go ahead and turn around and just lay flat. And for her, I am not going to raise up her shirt because she is a little shy. So I don't want to raise up her shirt because she's a little shy and ticklish. So first of all, I am going to inspect like I said, I'm not going to lift it up. So I'm just going to kind of inspect. And her abdomen is round. Her belly button, she's got an inner belly button. She's got an inner belly button. I do not see any pulsation going on in her abdomen. And so now I am going to palpate. No, I'm going to listen. And I'm going to listen to all the quadrants. I'm going to listen to all the quadrants for her vowel sounds. And her vowel sounds is present in all 4 quadrants. Now I am going to palpate. First I'm going to do a light palpation because she is very ticklish. So I'm just going to palpate and to see if I feel any kind of bumps or abnormality in her abdomen region. And then after I do like a soft palpate, I'm going to do a more deep palpation, and I want to assess her liver to see if I feel it, and then her spleen. So I'm going to come on this side and kind of assess her, see if I can palpate her liver at all. All right, this is going to be a deep palpation, so I'm going to have you taking a deep breath. Okay, and I don't feel. So now I am going to come over here, and I'm going to do the same thing, right side. Take a deep breath. Okay. All right, and I don't feel any kind of organ enlargement. So from here, since she's already laying down, I'm going to go ahead and assess her pulses, her aorta, her renal, and her artery, and her iliac, and then her femoral. So her aorta, and I'll be doing that with my with the bell of my stethoscope. So just breathe normally. And then right side, left side. And then of course I will go on down to her iliac and then into her femoral area. All right, so now I'm going to have her to go ahead on and sit up again for me. And go ahead and turn your legs on around. Okay, so now I am going to go ahead on and assess her cranial nerve 5. So I'm going to have you to kind of bite down. No, close your mouth, bite down, and her jaws real tight. Clench your teeth real tight. So I'm going to assess her muscle, trigeminus muscle, and then her temporal. And so that cranial nerve is intact. So then I am going to assess her facial expression, which is cranial nerve 7. So I am going to have you to smile. And then I'm going to have you to frown. Okay, now I'm going to have you to close your eyes real tight, real tight. Open them up. Okay, that's good. So that's assessing her facial expressions is her cranial nerve 7. I'm going to also have her to, can you puff out your, okay, all right. And so we just assessed for cranial nerve 7. So then we're going to take a look at cranial nerve 8. I am going to cover up one of her ears and then say some words and see if she can hear me. All right, we'll start over here to her right ear. No. Yes.
Apple.
I should have did that. Okay, I should have been over here to do that. Okay, no, that's right. No, here.
Orange.
Okay. So that is assessing for cranial nerve 8. So now we're going to take a look at cranial nerve 9. And cranial nerve 9 is, I am going to take a look at her mouth. I am going to have you to open your mouth, and I'm going to take a look at her uvula. Okay, open your mouth. Say ah.
Oh.
Stick out your tongue. Say ah.
Oh.
And then I'm going to take it back a little bit further and cause her to gag, which I'm not going to do that. And then I'm going to do cranial nerve 1, which is her nose. And so you tell me if you can smell that.
Yes.
Okay, so that's cranial nerve 1. So now I'm going to do cranial nerve 11. So I'm going to have you to turn your head that way, turn your head to the right, and then look up, raise your head up, and then raise your head down. So the cranial nerve is also intact. So now I am going to check her pulses. I am going to check her, I already checked her, I did not check her carotid. So I'm going to check her carotid pulse. I'm going to have you turn your head that way, and I'm going to listen with my bell of my stethoscope. Turn your head. Okay? Just relax. Now taking a deep breath. Okay? And I'm going to do the same thing on the left side. And I'm checking for her rate and the rhythm. So now I'm going to come on down from her carotid. I'm going to go ahead and check her brachial. And I'm going to do these one at a time. I'm going to find them one at a time. Hold your orb out for me. Okay. Hold that orb out. And her pulsars, her brachial pulsars are bounding. Okay. So now I am going to check her, you can just relax your arm, her brachial radial. No, her radial pulses. Check both of them. And then I am going to stand down. I'm going to check your pulses in the back of your knee here. You can go ahead and turn that way. Okay, now you can go ahead and have a seat. And that was her popliteal. So now I am going to check her dorsalis pedis and her posterior. So first I'm going to feel her. Just relax. Okay. Just relax. And then I'm going to feel her dorsalis pedis. And I'm going to do this on the right side as well. So her pulses are palpable and they are bounding. So now from there, I am going to examine her extremities for any kind of swelling, for any kind of abnormality that might be there. Okay, so I'm going to take a look at her arms and then take a look at this arm. I'm going to feel on down to her legs. Relax. Uncross your legs for me. I don't feel any swelling. or feel any kind of abnormality. So, and while I'm doing this, I'm kind of assessing her skin too, and I don't see any kind of lesions on her skin, but I'm just going to pretend that I found one. And so if I found the lesion, I would take a look at it and see if it is raised, and then look at the diameter of it. So from here also, we're going to assess her strength. So I'm going to have you squeeze my hands real tight. Put your arms up and push against me. Go ahead. Okay, that's good. Then I'm going to do her legs. Okay, push up against. And this one. Okay, moving on down, push on this side too. And then her feet, push, and then her toes up towards you. And then this one towards you. Okay, so we took a look at that. And so now I am going to check her gait and do her Romberg's test. Okay, I'm gonna have you stand up for me. So I am going to have you to go down a little bit. I'm gonna have you to walk on your tippy toes and walk toward me. Come toward me. Okay, that is good. And then walk back that way. Okay. Then I'm going to have you to put one foot in front of the other and walk for me. Okay. Don't hold on to anything. Okay. That is good. Okay. So now you can just kind of go back. Then I'm going to have you to close your eyes and just stand there for me. Okay. So her Romberg's test looks good. And so that concludes my examination for today.